Good afternoon, everyone, and welcome to the AVA webinar series with the Alliance Against Violence and Adversity. I'm your host, Jason Novick, AVA webinar coordinator and research coordinator with the Child Studies team at the University of Calgary. And there are just a few procedural things before we begin. So just so you're aware that this webinar is being recorded and will subsequently be uploaded to Ava's YouTube account listed on the website in case you'd like to rewatch it in the future, or you know someone who was interested in attending today but wasn't able to attend at the time that the webinar is being offered. And throughout the presentation, please feel free to use the question and answer function to pose questions to our speaker, and we will make time to discuss during the Q&A portion at the end of the webinar, and of course at the end of the webinar too. If you have questions upon reflecting on the presentation, please feel free to post in the Q&A function. So on a national level, we encourage all Canadians and visitors to Canada to learn about the Indigenous people of the lands on which they live, work, or visit, and become engaged allies together. And in the spirit of truth and reconciliation, respect the self-determination of First Nations, Métis, and Inuit, and their rights and responsibilities in cultures, languages, and the pursuit of wellness. So the title of today's webinar is Respect for Self, Others, and Place, a Parsimonious Framework to Produce Health and Well-Being, presented by Dr. Christine Divin and Dr. Stephen Crow. So Dr. Christine Divin is a clinical assistant professor of nursing at the University of Austin, at the University of Texas at Austin. A nurse since 1976, her passion for teaching was shaped by 17 years working with health promoters in marginalized communities across Latin America and along the US-Mexico border. She earned her MSN in 1997 from the University of Texas at El Paso and later her PhD from UT Austin in 2015, focusing on intimate partner violence and factors that promote health and adversity. From 2010 to 2024, Dr. Divin served as a family nurse practitioner in a Central Texas clinic for uninsured patients, also caring for IPV survivors at a local shelter. She has taught F&P students at UT Austin since 2016 and currently serves on wellness committees at both the school and state levels. Her current work centers on innovative approaches to well-being in nursing, including the Try Respect framework, and she encourages students to prioritize self-care as essential to caregiving. Dr. Steve Crow is a graduate of the Plan 2 honors program at the University of Texas at Austin and earned his MD from the University of Texas Health Science Center in San Antonio in 1991. After completing his internship at John Peter Smith Hospital in Fort Worth and his family medicine residency, which is now Dell Medical School's program, he has been a licensed physician in Texas since 1992. Since 1998, he has focused his practice exclusively on community health and HIV primary care in Austin. Dr. Crow's work is grounded in a lifelong commitment to respect, first explored during his undergraduate studies. He developed the Try Respect framework, which involves respect for self, others, and place, and also advocates for disempowering abuse, fostering honest and equal dialogue, and promoting compassionate care. He believes that a mutually respectful society is essential to addressing both social and environmental challenges. So without further ado, I will turn it over to Dr. Divin and Dr. Crow.
Great. Um, First of all, we would like to say that we're truly grateful to Ava for this opportunity to spend this next hour with you all. It's kind of serendipitous how things work out, but I happened to meet Andrea Dean in a taxi cab in Phuket, Thailand, and we talked nonstop about the wonderful work that Ava was doing and some of what we were doing with the Try Respect framework. And so have it, she says, well, you've got to do a webinar for us. And so we're just very, very grateful for this opportunity. Here we are. Before we begin, I too would like to just acknowledge all the wisdom of all the folks that have come before us and also the sacred space of this place wherever our soles of our feet are touching the ground. So we're very, very grateful for this opportunity. So I think I can probably begin by sharing my slides, right?
Yes, that would be great. Thank you. .
All right. Okay. So so learner outcomes, I'm not going to spend time on this, but we're going to just introduce you to the TRI-RESPECT framework, some of the evidence regarding well-being among healthcare professionals, and then highlight some of our findings from the pilot study that we've done with this framework. I'm going to go ahead and let Dr. Crow begin because he is certainly the one who initially had this idea.
Chris. Chris, I really want to thank you for allowing me to be a part of this and for years of uh, collaboration. And I certainly want to thank Ava. Um, um, the quote, final exam on the golden rule, it really actually, I've probably said that more than once, but I think the first time I was having a conversation with my father, and he was like, "Sounds like you're just talking about the golden rule," and I was like, "Yeah, but it's final exam time on the golden rule." Uh, Fortunately or unfortunately, these are interesting times. I tend to think of things in somewhat of an anthropological perspective to kind of look at the fact that we were um, you know, designed to be hunter-gatherers. We're clearly not anymore. We've had about 5 to 10,000 years of rapid cultural evolution and the accumulation of cultural information and artifacts. And here we are, we're living in 3 miles of breathable air. Um, there are nuclear weapons, there's climate change, and maybe there could be more study on how climate change actually interacts with the nuclear weapon infrastructure. Um, and that's just, I think, the way I think. I think it's pretty clear that what we need in these times is a cultural shift. We need a cultural shift that is easily understood, that it's available to everyone, children, people who have not been exposed to written language, that there needs to be a cultural shift that's available to everyone. Um, I've also come to appreciate the power of categorical issues, that if you use the word environmental, you know you're talking about you could be talking about anything from mass transit to what you're putting into the air, to what you're putting in the water, to what you're doing with plastics. Those categorical issues are important, and I do think of respect as a very important categorical issue that's hard to free up from the fact that it's in everybody's mission statement, and it also sometimes gets demanded by bullies. Um, but I do think of respect as a very important categorical issue. Um, it finally occurred to me after a long time that what we're really talking about is three separate respects: respect for self, for others, and place. And that I think that there's enough known science that would agree that there's scientific foundations for these three spheres. Respect for self is just simply saying that organisms are designed for survival. Respect for others is just saying, as one anthropologist said, um, one chimpanzee is no chimpanzee. We're designed to live in groups. Um, and we have a lot of wiring to help us do that. We have empathy or mirror neurons to help us do that. And so, respect for others is clearly something that is part of how our brain works. Um, and then respect for place. Um, I'm in no way anything but an amateur anthropologist, but in the reading that I did, there was never anything but a reverence for place in indigenous societies. And so I think that the foundations for these three spheres in the tri-respect model and the tri-respect framework are are firm. I also do think that it's simple. Um, I like I love this definition of respect that Chris found, because due regards for the feelings, wishes, rights, or traditions of others. In other words, it's an emphasis of respect for others with no mention of self-respect, but you are the other. We are all the other. Therefore, we all, if respect is going to be given to the other, we are the other too, and we deserve that same respect. In the dictionary, self-respect is sort of sequestered in another part of the dictionary, but I think in the tribe respect framework, it's right there. It is basically saying you are the other, and it is one of the spheres that allows people to say, I have a right not to be abused. I have a right, um, for no, I have a right to be okay too. Um,
Okay, so I think what I'd like to begin with is two events that happened in 2014 that were very instrumental for me. I was finishing up my dissertation. I was doing a beautiful qualitative study on exploring the lived experience of partner violence and salutogenesis in aging Mexican American women. And I realized as I was collecting their stories that they were talking a lot about respect. I would ask them, like, what message would you like to pass on to future generations? Because respect is intergenerational. They all voiced a desire to break the chain of violence for future generations, but they talked about loving yourself more, demanding respect. We deserve respect. Everyone's valuable. We're all of equal worth. They had this so clear in their mind about the message that was important. It was such a gift to hear their stories and their strength. The other thing that happened in 2014, while I was working at the shelter, I was also working at one of the clinics here in town, primary care clinics, with Dr. Crow. We worked together for 14 years there. And I remember one night as I'm finishing up my notes, I had worked at the shelter that morning, was at the clinic in the evening, the main clinic. And I just looked at Stephen. He said, well, how are you doing? I said, when will it ever stop? What are we going to do to decrease the incidence of partner violence? And he looked at me and he said, Coca-Cola. And I just simply said, what in the world are you talking about? And basically, he said, we have to advertise respect as successfully as Coca-Cola had been. And when I was on the Camino at the Compostela in 2022, walking the Camino, there's a Coke sign. It's like, yeah, maybe there's something to this. Tell me more. Because in 2013, I had been to Vancouver for a Nurses Network for Violence Against Women conference. And some of the nurse researchers were talking about posting public service announcements at the professional Canadian football team. I think they're called the Calgary Stampeders. I think you know way more about that than I do. But anyway, I just thought, man, there must be something to this. So I'm going to let Steve talk a little bit about this now.
Gosh, thanks so much, Chris. Um, that goes back to the idea that um, there's a lot of things we already know. We know that advertising has a lot of power. We know that simple ideas have a lot of power. Um, and a lot of times that space gets occupied by people that would like to sell us things. Okay. Sometimes that space can get occupied by people that, to put it mildly, don't have the best ideas or that don't have kind ideas. And it, um, the idea is basically, well, what if there was symbols and icons that represented a mutually respectful society and what we wanted to be about. That again were something that were so simple that a child could access them. Because I think we learn over and over that whether ideas are good or bad, if they're expressed simply, they can definitely have power. Um, and so I think it's important for those who are trying to create a mutually respectful society to be in that sphere. Um, and so Chris has taken us to the slide about a grassroots group of friends, and that's exactly right. We did have that conversation, and Chris so very kindly agreed to be just part of a kitchen table collaboration on just thinking out loud about these ideas. This was not part of a study, and there was no meeting notes. It was just how can we think about this further. And I think we started with the simple Venn diagram that when you talk about respect, you're talking about the three respects. They don't all center in the same place. Uh, they can all be centered, but sometimes no one's ever going to get it right all the time. But that's what we're trying to do. We're trying to center those three respects. Um, and I think interestingly enough, or maybe almost predictably enough, the persons that I found were most interested in these ideas were nurses, nurse practitioners, Chris and our friend Maria Saldiva, DMP, who teaches in San Antonio, and Maggie Taylor, a PhD that was once here at the University of Texas, who took some of basically these basic ideas and took them to somebody to, create the current symbol, to create this icon. And I think of these icons as sort of like a rough draft, and and also it's not copyrighted as something that's just available for people, perhaps like open source code, for people to think about as a framework that explains how people who might be working on intimate partner violence in one location are in fact linked to people who are thinking about climate change on another side of the world. That it's something that that we are trying to create this mutually respectful society, and this is something that links us from what otherwise often seems like a lot of different crises that have no relationship.
All right, so I think Jason mentioned that I've been very involved in well-being efforts at our school and on a statewide level with our Nurse Practitioner Association for years now, and some of this was before COVID. But as I would do these presentations, we always included a slide that says, "Why is self-care so hard?" And there was a whole long laundry list of reasons. But I thought, could respect for self, if we included this framework, could we somehow increase commitment to self-care? As Steve was saying, we had a lot of anecdotal evidence. People seem to like the respecticon. We coined that phrase for the symbol, and they liked it. We shared some stickers with folks, and we even put it on a T-shirt at one time. But we needed some, there were some of us that were in academia. We said, well, maybe we need to collect some data around this. So I'm just gonna, because this reality, as I was teaching our nurse practitioner students and also teaching young nurses who were, going to just begin their career upon graduation, and hearing about the reality of young nurses leaving within 5 years. And I'd always, put my nursing cap on that I wore years ago and say, next year I'll be a nurse for 50 years. And it's been an incredible ride. And I hope the same for you. And yet some of what we were hearing about burnout was pretty startling. And especially, higher amongst folks that worked in trauma areas in the ER, sexual assault nurse examiners. One survey that I read, because I work closely with our nurse practitioners, students, was that 70%, these were like over the past 2 or 3 years, Medscape has done surveys on NPs in the US, and 70% of those NPs reported burnout. And we did a survey in our state as well of the NPs in Texas that were part of our association, and it was the same. And what was startling was lack of respect was the second leading cause of that burnout. And all of those so it's like, yeah, maybe this framework could be helpful. Those of us who work with trauma, know that there is that cost of carrying the compassion fatigue, the secondary traumatic stress. I think what's important to recognize is that our own vulnerability is not a sign of weakness, but if somehow we can embrace that, and listen to that and not have shame around our vulnerability, that can be definitely a strength. There was a beautiful review of literature that I read while I was preparing for this from some nurse researchers in Ontario, but it was on well-being of IPV support workers. And one of the studies that they mentioned in there, it was like 93% were reported that they experienced secondary traumatic stress. And one person in that study felt that employers cared more about the well-being of their clients than their workers. And self-sacrifice and exhaustion were viewed as badges of honor. So what do we do with the fact that our working life conditions could be, something that, could contribute to the burnout if they're not healthy in places of well-being? Deeply caring for your job could actually be a risk factor. So what are our next steps? And we decided that we would have 2 focus groups with our faculty at UT to introduce this Tri-Respect framework and also see, what we could learn about, would this be a useful framework to decrease burnout, decrease moral distress? We ask questions about how you would define respect, self-respect. Why is it important? Is it important for health, self-care? How do we build that self-respect? And could we use it to prevent burnout and decrease moral distress? And we had 2 focus groups with 15 faculty, and they were just so generous with their time and their ideas. There were 4 themes that surfaced from the input from the data from those 2 groups. And similar to what we were seeing in the definitions of self-respect, but the sense of value, not only valuing yourself, your authentic self, being true to yourself, self-love, self-compassion, self-acceptance, a lot of overlap in those terms, but also acting according to your values. One of the things that really stood out to me was a sense of giving yourself grace, just that, embracing our imperfections. So that was a real telling theme. Then we looked at this word pillar, and it seemed like that was also coming out of some of the responses that self-respect was foundational, not only for self-care, but so that we could establish genuine relationships, those healthy boundaries, and also to be an advocate for ourselves and others. One of the participants said, well, if you don't respect yourself, it's hard to care for yourself, right? That's a fundamental block. And then the other theme was that this could perhaps be the missing link in our self-care curriculum. We talk about self-care, we give tools on self-compassion and being compassionate and how that can decrease burnout. But to further respect or further reflect on, self-respect and just our inherent worth, no matter how productive we are, just that value we are as a human being. So that was my mandate to then take some of this, wisdom forward and create a self-respect module for our self-care curriculum. One of the other themes was time, that we need time to reflect and reframe, time for the self-care. One of the participants had worked in hospice and palliative care and said that that's built into the system. It's not necessarily built into all the systems where we work, but that time to step back and it's like, oh, is this the life, that I'm embracing right now? Is that, in congruency with my values? And of course, when we started talking about, the tri-respect framework and decreasing burnout, we had to talk about system level change. And that was pretty poignant, some of the quotes that people had around system level change. I recently participated in a webinar at the School of Medicine here with Dr. Tate Shanafelt from Stanford, and he had a slide that said 80% of burnout is systemic and 20% is individual. So, we had talked within some of our well-being efforts on, well, if we could just be more resilient. And, we're going to invite somebody here from the Center for Resiliency, and why all of that is so good, so important. We can't, not look at some of these systemic issues, and they're perhaps sometimes a little bit harder to work on. But one of the studies that Dr. Shanafelt mentioned was the fact that even some of the physicians that reported burnout had high resiliency scores. So these were the implications of our findings. And, folks said that it was a simple parsimonious framework that we could incorporate, could help with both individual and systemic level change. And let's look at this in our self-care curriculum. So that's what I've been working on this summer, is a specific module on self-respect. Future research, of course, that happens with every study. We need more studies, right? We would like to see some more qualitative studies, introducing this framework to see how folks define it, to see if it could be a useful tool. Healthcare systems, it would be awesome if we could, do some research with leaders in healthcare, as well as with those that are working in that system. We're hearing more and more about cultures of well-being, mattering to the places where you work, where the needs of the employees are respected and valued, and we need leadership that embraces respect and listens to that. So I think, yeah, it could be helpful there. Now, one of the things that happened as I'm doing these focus groups on well-being, I'm also preparing to go to Thailand for the Nurses Network for Violence Against Women International. And thank goodness we did, because we wouldn't be sitting here today if I wouldn't have gone there, because that's where I was able to meet Andrea Dean, which is a really gift. But anyway, I just, in doing the review of literature to see where this whole self-respect component was in healing and preventive efforts, discovered that there was just so much overlap. Some of the qualitative studies show that participants talked about their self-respect being totally diminished, because of abusive relationships. But we're like, how do you rebuild that sense of self? And just realize that there was so much overlap in some of the terminology, self-respect, self-compassion, self-acceptance. But basically, one scoping review that I saw on self-esteem was that, self-esteem was self-respect, self-concept, self-affirmation. So there needs to be, I think, more research done to figure out what's that unique contribution of self-respect. And then could this tri-respect framework be useful to those working with IPV survivors, those healing from IPV? Could it be used in preventive efforts for support workers in IPV to try to help prevent burnout? So I think, there's lots of work that continues, that we need to continue. One of the things, this is the last slide, and then I'll let Steve finish up. But we talked about in our focus group ways to build self-respect, and just that whole sense of giving ourselves grace and not being so hard on ourselves, embracing our vulnerability. I just remember the words of this theologian when I worked in Latin America, who's Henry Nouwen, actually, who said, "We are as vulnerable as the people that we care for." And I think we forget that sometimes as healthcare workers, as humans. We need to embrace our vulnerability. And then also to constantly think about, is the life I'm living consistent with my values? And I think that's so important, because maybe, what are our values? We need the time to reflect on those, because that embracing those, that's self-respect. And just for an example, about 3 years ago, I was taking a little bit of time to start reflecting on my own life and my 60-hour work week. And it's like, this is not sustainable anymore. My family was saying things to me like, "Oh, you're just trying to squeeze us in," and just realized that I needed to go part-time at that time because my values of family, of health, valuing my own health were not quite consistent. Um, yeah, with the behaviors at that time. Find the things that give you joy, the healthy boundaries. That's so important. Just I remember Dr. Crow and I worked together for 14 years at the clinic together. And I remember at times when I'd feel overwhelmed or just another task at hand to do, and he'd say, you got to get in touch with your inner I can't. And so that's always like just been there in the back of my mind, like, yeah, and that helped me, I think, establish some of those healthy boundaries. But that has a lot to do also with the relationships, how to establish kind and respectful relationships as well. So we need to take that time to reflect and reframe on that. I want you all, because I know we've given lots of input, but just to kind of think about one thing from this list that you might want to focus on this next week, and to help build your self-respect. And one thing that I always recommend to our students when I give lectures on well-being is like, find that friend that's going to hold you to this, that's going to be your support person. You got to hold those friends and community close. So I'm going to turn it back to Steve now to help kind of wrap us up.
Yes, thanks so much.
Mhm.
Um, I really, you could probably find other words to use besides uh, advertising, but to me, that felt like an honest acknowledgement of what's needed all over the world. There's people doing work to basically think about the well-being of others. They're doing direct clinical work, or they're working on it in a theoretical basis. Um, but the how do I want to put this? Uh, Kindness could use some advertising, and kindness can only emerge from a universally or mutually respectful society. And also, it's only, I believe, that kind of society that's likely to solve some of the riddles of our weapons and our waste. And I do think, there's a place where children and other people are grappling with, very simple expressions of ideas. Uh, and I think that the people who are kind and do want the mutually respectful society need to be in that space as well. Um, uh, we're looking for a space where there is fair dealing, where uh, disagreements or negotiations can be solved uh, with listening dialogue, honesty, and equality as a basis. I think um, anyone who's ever worked with an abusive person knows that pe you know, people who are dealing with abuse are wanting to not allow that kind of dialogue. And so um, I think that what is needed is a simple narrative that allows us to also unwind abuse. That and a narrative that can easily be understood by anyone, and that may allow people with very, very different opinions to kind of enter into conversation about what constitutes trying to center these three respects. Um, um, Obviously, I think there's metrics that would need to be involved, metrics about violence, metrics about detention, metrics about hunger and homelessness in terms of whether you're being successful as a mutually respectful society or not. But I think at first, if you have missions, I think it's important for those missions to be simple and clear, and for them to clearly connect how, again, one, very different endeavor could be connected to another endeavor under this standard. Um, I hope that if nothing else, that maybe this sparks ideas in other people. If the particular icon or the particular framework doesn't make sense, that they'll say, "Gosh, let me fix that for you." Uh, but I think it's these are the kind of things that I hope more people will think about. And Chris, I'm going to turn it back over to you. Oh, I think Chris is handing me the picture of the coral reef and reminding me that this is still my slide. I think if we have a clear idea of hey, we're trying to create a mutually respectful society here, then that to me is something like a coral reef, which has an ecosystem with unlimited different components in terms of living creatures, microbes, um, even different conditions within the reef. But somehow it's all there is something that connects that whole ecosystem. And if again, if this narrative doesn't work, we are going to need to look, I think, um, for narratives that do connect all the different people working in all of the different areas of a mutually respectful society.
Okay, so in closing, I would just like to say that it's been such a gift to sit back and have some time to reflect on all of this summer, because as I'm looking at the literature, as I'm looking at what's been done in regards to respect, I realize that this is nothing new, especially with our indigenous communities that have been talking about this, living and breathing this for years and years and years. And I found that beautiful icon that the First Nations Health Authority in British Columbia uses, and respect is right there with just such a beautiful definition. And that first quote is from there, and as many of you may be familiar with, but just that knowing how to be with oneself and with others, honoring where we come from, so important. And then the bottom quote is from an Indigenous psychologist and professor at the University of Western Australia, who talks about this collective flourishing, this collective self-care, that, we don't have to do this alone. Like sometimes Western societies, Western medicine tends to be a little bit individualistic, but we need one another. We really do. And just that whole sense of collective well-being of communities, environment. So I'm so grateful. I think to all of this wisdom, because I think it's just, the try respect framework, I think is just another way to try to get us to remember what people have known for a long, long time. Um, and I guess my last slide would just say Happy International Day of Self-Care. Andrea, when she invited us, she said, well, why don't y'all talk about self-care? Because July 24th is the International Day of Self-Care. It's like, oh, really? I've been doing well-being work for a while and I didn't even know there was such a day. But it's that idea of 24/7, July 24th, 7 days a week, we practice self-care, because there are things out there that can bring us despair and can seem dark sometimes, but we have to figure out ways to help each other keep that light shining brightly. I'd like to close with that quote from, this is one of our focus group participants last summer, but she just said, I do think change is possible, and I think it's coming, and it's slow going, but I think it's there, and there is indeed hope. And I think, we give that hope to one another as we do this work that keeps us, will hopefully help make a big difference. All right, I think I'm going to stop my share and we'll give it back to Jason.
Thank you so much for your excellent presentation. I'm just going to share my screen. And thank you so much for joining us today, Dr. Divin and Dr. Crow, as part of AVA Webinar Wednesdays, and for sharing your insight on the Try Respect framework. And I believe that your message, that respect for self, others, and place can serve as both a personal guide and a systemic foundation, which is especially relevant in today's environment. And with your excellent presentation, we'll now open up the floor to questions. And I see that if you have come in with the Q&A function in Zoom, so I will just open up those questions. And also, in accordance with the slide that I'm sharing now, if everyone could please, I'll also post the webinar feedback survey in the chat shortly, but the QR code is here for you. I'll also post the URL in the chat, as I just said. So looking at the first question, how much money do we believe we need for our family needs, cultural expectations, job requirements not open to their own needs, family not connected enough to know how to fit in other needs? How can someone survive, for example, when they are in debt? This is what the first question asks.
So I think that's a question about how much money people need in order um, to make it and to have a functional life and to have enough basic needs met in society. Do I have that right?
Absolutely.
Yeah. Uh, it's a great question. I can say it's pretty hard from what I've observed. Yeah, I know that for a while there was kind of in the US it was kind of a focus on $15 an hour as and I think those days are gone. I think it's um, I'm not in any way an expert on this, but what I do see is people do struggle. Chris and I have both worked a long time um, in a world where people struggle to get into the clinic, especially as, anyone who has any kind of disability that makes the usual um, public transportation systems less, less available to them. Um, so, um, I, y- y- uh, and I do think that is an area of important study, and I know that there are people who are much more expert on that issue than I am. But it is exactly the kind of thing that it's a fantastic question for anyone that's wanting to participate in a mutually respectful society is how much money does it take to get by, and how many people just don't have enough? How many people are having food insecurity? How many people are having housing insecurity? Um, how many people's medical care is impaired by their ability to get to clinic? Those are metrics that that could that could be used to measure whether how we're doing as a mutually respectful society.
And I also think it's important with all those frontline workers, that keep the clinics going. I think of our own medical assistants and the people that keep, the hospitals clean and, do all of that frontline work, answer the domestic violence calls, all of that, just that there's just salaries for those people as well. That's part of respect. Um,
Absolutely.
Thank you so much for your feedback with respect to how family needs, cultural expectations can define one needs, especially when stuck in debt. And the next question asks, how would one assert their own needs when stuck in an abusive situation and potentially leave such a situation? For example, if one was with an abusive partner or was experiencing some form of abuse while working.
Beautiful.
Yeah, yeah. Um, I think always the whole safety issues is so important. And that's why we always, make sure that there's a safety plan in place, if when people are ready to leave those relationships. And I think, as far as, if there's any abuse in a working situation, that's where respectful leadership comes in. So you'd be able to talk about that. But yeah, that's where the community comes in, and you need to have. We were lucky at our clinic if we were seeing anyone that was talking about being in abusive relationships, we had an integrated behavioral health team that we called in. So it was a kind of that it takes a village to come in and then talk with that person, call the shelter if it was necessary, but mostly just to create that safe space, and also the trusting environment where people could even talk about that and their voices would be heard. And sometimes that didn't always happen with the first encounter, but as you got to know, your patient over time, folks would have that trusting patient provider relationship, where they were able to say, oh, things aren't going really well for me right now at home.
I, um, I thank you so much, Chris. Oh my gosh. Oh, there's the camera. Uh, I, I have just a few thoughts on this. One, I think that to me, it always starts with someone saying to themselves, this is not okay. And then I think everybody who works in IPV, and Chris has much more knowledge about this than I do, knows that, deciding to leave can actually be quite dangerous. So, but I do think that anybody can tell themselves in the privacy of their own self, this is not okay. And I think that's where it starts. And then I do think that self-respect does give you the right to assess, what are the power dynamics? I mean, there's people there's our fellow humans that live in societies that are massively abusive, where any any inkling of disagreement, say with the personality in charge, is going to put you and your family at risk, and escape, to say the least, from some of these most abusive societies is extraordinarily difficult. So you may have almost no power that is external to yourself, but you do have the right to at least admit to yourself, this is not okay, and then start calculating how, where you stand in the power dynamic. If someone has all the power and you have none, then you have the right, not to challenge someone when you know that that's only going to result in one's harm. You have to kind of think in those terms, and then think about strategies that may allow a change in the future without doing anything right now. Uh, Chris?
No, I think that's where, we were thinking about how do you facilitate this journey back to oneself of just this getting in touch with your inherent, self-worth and dignity. And that also, will then help you start thinking about the types of relationship that you deserve, the kindness and the respect that you deserve in a loving relationship. But yeah, we can never make that decision for another person, but we can facilitate that journey and be present and offer resources.
Thank you so much sorry, go ahead. Thank you so much for providing this insight with regard to how to assert one's own needs and
Mm.
leave an abusive situation, whether this be within the realm of an intimate relationship or a job or other circumstance.
Mhm.
The next, thank you so much for that. And so the next question asks, with reference to the respect framework, why are mostly males using violence as part of their own sense of survival and self-worth whenever, in such instances, when violence is demonstrated?
Mm.
That was such a great question.
That's a great
And
question. And this is where, like, I always talk a lot about upstream approaches. And I think that we have to teach children, young women, young men, young children, we have to teach them the power of respectful relationships with others. But also, then we also need to teach people how to respect themselves. Because being violent, I don't think is respecting yourself necessarily. When you practice that violence toward another human being, I think it kind of erodes self in a sense.
yeah, I love that question. I do want to validate that by any reasonable assessment, if you're using violence as a metric, and let's say you're using people who are so violent they have to be detained, by any metric, that's more men than women, and anyone who works in the helping professions knows that yes, there can be abusive women, but golly gosh, are there a lot of abusive men? And one thing I've been uh, interested in for a long time is low empath personalities, might be one way to put it. The classic DSM-5 categories of uh, antisocial and narcissism and stuff like that. And I think of all human beings as human beings, if I feel like somebody has some of those tendencies and I'm seeing them as a clinician, that they're a patient and they need help. But I think that a field, how do I want to put this? I think there's just so much more we could be doing to think about typical dynamics um, of, let's just say, the abusive personality, and how that usually that personality will work against anything that, say, based on listening dialogue, honesty, and equality, because a lot of times a more abusive personality will be threatened by those things and would like to be in charge. They would like to be in charge of, um, a family, or the place where somebody works, or a country, say, or whatever. Um, and so I think that how to uh, I'm just always fascinated by the questions, not only of like, why is it more men, but how do we disentangle that personality from the people who tend to really want to go along with an abusive solution?
Mhm. Yeah, I think about there are several good programs that have been around since the 80s. I know that one started right here at the shelter where I was able to work this a few years, but it's called Expect Respect, and that's been, I know several school systems have adopted that program, and where they teach respectful relationships. But I must admit that, I don't know how much that self-respect, respecting yourself is woven into those programs. And I'm thinking about, as I was collecting my stories from the women for my dissertation, so many of the people that they were married to were wounded. They were wounded people in their childhood, and so how do you, somehow grow that self-respect, early on, um, yeah, and plant the seeds for a more peaceful, kinder relationship. Yeah.
Yeah, exactly.
It's
Thank
an
you so much.
upstream approach. Prevention is so much easier, I think I've always said, than putting people back together again, so how can we promote, yeah, respect and kindness?
Absolutely. And thank you so much for providing this valuable feedback with respect to not only why the majority of perpetrators of violence are male, but also with respect to the importance of preventative measures. And
Yes.
I'm sure a central component of your research, a central emphasis with the respect framework, as you emphasized within the presentation and also in accordance with one of Ava's mandates, also to prevent and, of course, discontinue the cycle of violence. And also the one of the final questions is asking if you have any advice to implement the try respect framework in a structural way when working within specific constraints. So, for example, the constraints associated with the healthcare system or other systems.
I'm going to talk a little bit about our meetings with Audrey, or no? No, just
I would, there was some crosstalk.
yeah.
We're sharing one
Yeah.
camera also.
Mm.
I would, um, I would just say again that, this, this particular symbol, is not copyrighted. And so um, if it sparks something in somebody, then they don't have to seek, there's no organizational, there's not an organization behind this symbol. So, it's out there in the public domain. And so that means that anyone could, again, if it sparks something in someone, they could go to their administration if they had the right kind of supportive administration and say, hey, what do you think about using this as a simple expression of our values that maybe everybody could access, and even patients could access it and say, yeah, you're not really being accountable here. Um, uh, or okay, again, it doesn't work for you. Well, what does it spark something in it that's in you that's similar that would work? I mean, I don't, as Chris was saying, I think of this as, trying one particular frame of ancient wisdom, and trying to maybe get to some clarity on what actually does motivate a lot of people, and maybe especially motivates people in really mission-driven work like IPV, public health, um, change work, anything like that. It speaks to clarity, but maybe somebody else has an idea that's also clear but different, and that would be great.
Yeah, thanks, Steve. I think, one of these, we know that there seems to be somewhat of a shift to trying to build cultures of wellness. There's, chief wellness officers at a lot of different health systems now. And, we just in having that dialogue. And we know that like burnout's contagious, but so is well-being. And if we can find leaders that are willing to embrace this framework, as well as like have some listening sessions and dialogue with folks about how do we live this out in our workplace. the work-life integration, the embracing our vulnerability, being more, self-compassionate, and like, how do we do that in real life? So I just think it's, different. I think different organizations will use it differently, but yeah, it's definitely a tool that I think it's important to put in our self-care toolkit when we think about how do we be as healthy as we can be. And we'd be happy to send some stickers to Ava if anybody wants them there up in where you are at the University of Calgary. So we're just so thankful for this opportunity.
That's a great idea. That would be great. We could follow up by email about that. And thank you so much for your insightful feedback with respect to this question about the application of the Try-Restrict framework, and also your greatly insightful and excellent presentation on this topic, which will constitute a valuable resource as part of the AVA Webinar Wednesday series. And I'd like to take the opportunity to thank both of you for taking the time to present along with everyone in attendance as part of this webinar and other webinars as part of the AVA Webinar Wednesday series. And that concludes the question and answer period and this presentation today. So I hope that everyone has a great day, and thank you so much for attending.
Thank you. We're so grateful.